the moderator for these events, and I'm really blown away at some of the great speakers and content that CarePatrol has been putting together recently. So we've got a few little housekeeping items, and then we're going to meet the CarePatrol team, and then we're going to jump into our topic today, which is a really important one: preventing isolation and loneliness during the pandemic, and important holistic approaches. So we're going to meet Morgan Bird shortly. First thing that we want to do is give you the best experience possible. So what I recommend is that if you feel comfortable, you can introduce yourself to the other attendees, and you can do that via chat. And we have a wide variety of attendees here, from other senior serving professionals to older adults to caregivers. And so by using chat and communicating amongst yourselves, there's lots of resources that can be had. Very important, use the drop-down menu that says all panelists and attendees. Second, we really want to make this interactive, and our speaker, Morgan, today, she really wants to hear your questions, concerns, and comments. And so the easiest way to do that at any point during the program is to just type in, using the Q&A box, your question or comment related to whatever Morgan is talking about. In addition, if we have time and we're fielding questions at the end and you don't feel like typing them in, you can raise your virtual hand and we'll bring you on and you can ask that question. Also, just to, if you're new to Zoom, you can customize the way Zoom looks on your screen by just clicking on any box. You can minimize and maximize it. You can also change from, in the upper right-hand corner, you can toggle between speaker view and gallery view. And what that does is, gallery view is everybody is equal on the screen. Speaker view, you only see the person who is speaking. As I mentioned, you're going to get to meet Enrique here at the end of the program, but we want to thank Oak Manor Healthcare Center, which is part of Access Healthcare, for supporting today's discussion. And as I said, you're going to get to meet Enrique at the end of the program. Enrique is in the audience. If he can drop his contact into chat, that would be great as well. And now is the time where we get to meet the CarePatrol team. So let me stop sharing my screen and ask our friends from CarePatrol to, if they can, turn their video and audio on. But I'm going to go through here and prompt you, and hopefully we can get everybody on. And I think when Cindy gets on, if Cindy, when Cindy gets on, if she can.
You start my video, Steve?
Yeah, sorry. Boy, this is, I'm just going through as quickly as I can to get everybody's video on.
Thanks.
You on there? Okay.
Yep.
Yeah. All right. So Cindy, while I'm bringing everybody on, if you want to share a little bit about CarePatrol, and then we'll get to meet everybody.
Steve, I think my video went back off.
Oh, yeah. There's so many of you. I'm getting confused between whether I'm starting or stopping. Here we go. Come on. Cindy. There you go. Okay.
Great. Thanks, Steve. Welcome, everybody. So glad you are able to attend today. I'm Cindy Yar Evans, the owner of CarePatrol of the Baltimore-Annapolis corridor, and I cover part of Baltimore County and Anne Arundel County. But just to give you a sense of what we do, we help seniors find safe living options at no charge to the client. And typically that's for assisted living and memory care. We're all local, hands-on, and we work really hard to understand our seniors' needs today and what they might be in the future, what they want to do, where they'd like to live, and also in looking into their financial capabilities. Um, we're a little bit like a real estate agent in the sense that we identify assisted livings and we tour our clients. So we're matching our clients with the communities that we have pre-looked at. And we are able to do that because we looked at the community's clinical capabilities, their staffing ratios, amenities, and we also review all of their deficiency surveys. So we know that it will be a safe match. But since we have so many real life experiences, we can do a good job with that in matching these people. Even during this pandemic, we've been arranging for virtual tours and in-person tours, and we assist them through the whole process. So we're sort of holding their hand literally and figuratively through the whole process, so they feel like they understand what's going on. But I'm lucky to be one of 7 franchises that cover Maryland, DC, and part of Virginia. And for us, we feel our most important role is to advocate for our clients and the senior population. But and just to give you a sense of our experience, we've placed over 2,800 clients in over 950 communities. But so now everybody can say hello for themselves and talk about their territory.
Okay, and I'm just trying to figure out where that extra sound was going. Okay, so this is my favorite part. We do the Brady Bunch thing. And so I'm going to start with the Paula on my left. So Paula, if you want to introduce yourself.
Great, thanks, Steve. Hi, I'm Paula Sotier. I'm owner of CarePatrol Baltimore. We cover the areas that Cindy does in Baltimore County, Baltimore City, and parts of Hartford County. I'm actually really excited about listening to Morgan. I know everyone on, this Brady Bunch picture has had to deal with seniors who've been really struggling with isolation. So I can't wait to hear about some of the things we can bring to our clients tomorrow.
Great. Okay. All right. And then we got Rhonda Thomas under Cindy. Whoops. Unmute, Rhonda.
Good afternoon, everyone. I am the Senior Sales Consultant and Marketing Liaison for CarePatrol, covering Montgomery and Howard County.
Great. Thank you, Rhonda. And then under Rhonda, we've got Amy.
Good afternoon, everyone. I'm Amy Fager. My husband, Gary, and I are the owners of CarePatrol of Delaware and Maryland Eastern Shore. We're here and ready to help you with your care needs here on the shore.
Great. And then under Amy, I've got Robin Edwards. So I'm make sure.
Okay. Hi, I'm Robin Edwards. I'm with CarePatrol of Northern Virginia, covering Fairfax, Arlington, Alexandria, and part of Loudoun County.
Great. Thank you, Robin. And then next to Robin, we've got Laura. Whoops. Sorry, Laura, I muted you when I meant to unmute you. If you can, Laura, if you can unmute yourself. There you go. Whoops. There you go.
Hi, I'm Laura Wagner Thibodeau, and I work for Paula and covering Baltimore County, Baltimore City, Hartford County. And we're almost 3 years.
Great, thank you. And then we've got Cindy Evans. There you go.
I already started us off, so hello again, everybody.
Oh, shoot, I'm losing track of my square here. Okay, so on top of above Cindy, we've got Charles, and man, I got to stop clicking the unmute button when I mean to. There we go, Charles.
Okay, good afternoon, everybody. I'm proud to join my CarePatrol franchisees. I work in Prince George's County and Charles County, and we welcome you to this webinar. Nice to see you.
Thanks, Charles. And then above Charles, we've got Bonnie Danker.
Good afternoon. I'm Bonnie Danker. I'm thrilled to be here with you today. myself and my team are all on the call, and we cover Howard and Montgomery, and we also go into the district. So we're very happy to have you join us, and we're excited to talk with Morgan and really put into place some strategies for holistic support.
Great. And then I'm going to end in the center square. So to do that, I'm going to do Star next. So Star.
Hi, I'm Star Sowers, and I work with Bonnie Danker with Howard and Montgomery County, and it's really good to see all of you here today. Thank you.
Excellent. And last but not least, our center square. What was that? Tic-tac-toe, or I forgot the game show.
Hollywood Squares.
Hollywood Squares. That's it. Okay. So our center square is Bonnie Elliott this month.
Hi, everyone. Welcome. And ditto what Paula said, such an important and well-needed topic. We've certainly learned that it's been reinforced through the pandemic, right?
Yeah.
So I'm Bonnie Elliott, and I own the CarePatrol office that serves Carroll County, Maryland, Frederick County, Maryland, Washington County, Maryland, and Loudoun County, Virginia, except that tiny little corner of Sterling that Robin serves. Thanks,
Great.
everyone.
Well, thank you all for putting these together, and thanks for asking me to be your moderator. It's and so with that, if just so I don't end up doing something to take our speaker who I'm bringing on, Morgan Bird, who's the founder and CEO of Kingdom Destined Change. If the CarePatrol team can, if you guys can turn off your own mic and audio, and we'll see you at the end of the program. And then we've got Morgan on here, and let's see, Morgan, welcome.
Thank you, Steve. Thank you so much. I'm so happy to be here today. Yes.
Yeah, this is a really a topic where folks are just grasping for resources. So, but before we jump into your program, let's get to know you a little bit better. Can you tell us a little bit about your background and what led you to the career that you're currently in?
Yes, for sure, for sure. So of course, once again, my name is Morgan Bird. I'm originally from Colorado Springs, and I moved here in the DC area about 4.5 years ago. And so I currently have a bachelor's in psychology, a master's in health promotion, and I'm currently finishing my doctorate in healthcare administration. And so what interests me most about mental health, emotional health, psychological health is both working in a clinical sense. I work with a lot of children with different disabilities, also working with the elderly population. And so, of course, when you work with those populations, you can identify some of the concerns that pop up regarding their mental health. And the thing that interests me the most is that in society, we have such a negative stigma as it relates to mental health, which kind of plays back to how us as a society, we address some of these mental health concerns. And so looking at this pandemic, looking at some of the things that have taken place, and you all will identify through my presentation, the elderly population has been hit significantly regarding this pandemic. And so being able to connect the social, psychological, emotional, physical, and just provide some helpful tools and strategies for you all to just implement day to day, not only for your staff, for your residents, for yourself. And so that pretty much what led me to doing what I'm doing now is educating people on mental health. I always tell people there's a connection. And so if you take care of your physical health, you also have to take care of your mental health. And failure to do that is a, domino effect. Not taking care of your mental health, it plays on your physical and vice versa. And so once again, this is why I'm here to be able to share some nuggets. I'm the CEO and the president of Kingdom Destined Change Agent, where we're passionate about empowering effective change. And we do that by increasing in knowledge. And so that's who I am. Yes.
Great. Well, that's fantastic. So let's jump right in. And as I think you've got a PowerPoint, I've got a backup just in case we need to change roles. But if you want to share your screen, and while you're doing that, I just want to remind the audience that we want you to ask questions. We want to hear your comments and concerns. The best way, the easiest way you can do that while Morgan is speaking is by just typing into the Q&A box any questions that you've got. And then I'll read those aloud to her. And then at the end, if, you know, assuming we've got time, you can raise your hand and we'll bring you on audio. But I'm gonna turn my video off, and Morgan, take it away, and audience, make sure to ask some questions.
All right, thank you. Thank you so much, Steve. So once again, everyone, my name is Morgan Bird. I'm super excited and happy to be here with you today to talk about some holistic approaches or practices on how you can prevent social isolation and loneliness. I know we're dealing with this pandemic and can be hard on so many. So I hope that you all get some nuggets. I always tell attendees that I speak to or speak with, please make sure you have something to write with, something to write on, because there's a lot of information and I want you all to get this information, okay? All right, so moving on with our agenda, we're first going to be talking about our learning objectives. So what are those key things that I want you all to take from this presentation? And then secondly, we're going to be talking about the importance of maintaining a healthy well-being. And so we're going to go back to the basics. I like to use that term, go back to the basics, in order for us to really make some effective change and work on growing and developing in our ability to be healthy, mentally, emotionally, physically. But not only that, but encourage others to do the same. It starts with us educating ourselves and getting back to the basics. Second, we're going to talk about some warning signs. That's very important, especially those that are working in healthcare facilities, educating your staff. We'll talk a little more about that as well. What are some of those warning signs that you need to be mindful of, as well as some negative health outcomes. We all know that if you don't pay attention to certain things, things pop up. And so I want you all to be mindful of that as well. And lastly, we'll talk about some holistic practices. And so once again, making it easy, make it accessible to you all to be able to share within your organization. We're going to have a moment for questions, and then we're going to go over some references that I do have for you and resources. All right, some learning objectives. So once again, these are some key things I want you all to take from my presentation: understanding the importance of maintaining a healthy well-being. And so we're going to go through the 3 key areas of what contributes to our well-being, and kind of give a little more context of why that's important. So once again, I want you to pay attention to the connectiveness, how everything is connecting in your body, your mind, your spirit, your emotions, and how that impacts your physical and mental health. Secondly, we're going to talk about, once again, warning signs and negative health outcomes linked to social isolation and chronic loneliness. So if it's not dealt with, it can be prolonged and create other issues. And then lastly, some holistic practices and approaches that can be used for you and those in your facility. So what are the 3 components of one's well-being? So now we look at 3 main: mental, social, and physical. So when we look at the mental health, we're looking at mental health also including the emotional and psychological well-being of who we are. So what does that mean? That means that the mental health, our mental well-being, impacts how we act, how we think, and how we feel. And so when you look at certain situations that happen, or as we're looking at this pandemic, if you have a high level of emotional and psychological well-being, you're able to navigate during this pandemic a little better than those that may not. You'd be able to bounce back. For example, you may come across some people that have dealt with some just unforeseen situations in this pandemic, losing their job, losing a loved one. And if their emotional and psychological well-being or health are not intact or not at a level that is healthy, they'll find it hard for them to progress through this pandemic, progress through those certain changes. And so being able to be emotionally and psychological well helps us to be able to balance our emotions, being able to deal with our emotions in a positive way, being able to cope with things that happen in our life, being able to be more resilient, being able to adapt to the changes that happen. And like I said, being able to identify or even being able to, well, let me put it like this. A lot of people sometimes that struggle with their emotional and psychological well-being struggle with identifying what that emotion is. They know they're sad, they know they're upset, something's going on, but they can't really identify. And until you're able to identify, you're not able to deal with that situation in the most effective way. Same thing with your psychological well-being. It impacts, you know, how you deal with relationships, how you view yourself, if not taken care of. It can even negatively impact how you talk to yourself, developing that negative self-talk if it's not at a healthy level. So that's another important factor of why taking care of your mental health, emotional and psychological well-being is so important. It also helps you to identify purpose in life. And I think as we're looking at the elderly population, which literature shows that this pandemic has impacted the most, have been hit the most during this pandemic, many start to feel like there's no purpose of living. Their life is not worth living. And so we want to address those things, because when that desire to live or that desire to just progress or find meaning in why we here starts to dwindle, then we see some very serious concerns popping up. One also leading to suicidal thoughts as well. And so we'll talk about that. Social well-being. So this ties in really closely to social well-being. That's the second component of our well-being. So what is social well-being? It's the ability to communicate, develop meaningful relationships with others, and maintain a support network that helps you overcome loneliness. And so once again, with this pandemic, it forced us to be in this isolated place, mentally, physically. We're not able to give hugs and go and meet with people and do things that we normally would do with people that we care about, our loved ones, our friends, our family. And so it forces us to be more creative in how we can maintain those relationships. Once again, I like the term getting back to the basics. So this may require us to, like I said, be creative, think outside the box, utilize technology. We'll talk about some more techniques that will be beneficial, as well as, you know, what other nursing homes are doing around the United States. But social well-being is so important to our overall mental health, our overall well-being, because if we're not connected, once again, it plays into how we view ourselves, how we view society, and it starts to negatively impact a lot of things in our life. And of course, the physical well-being is so important as well. So once again, it's connected. As this image that you see on the screen, you see that some of the areas overlap, and they're connected and they're ongoing. And so you can't deal with the mental and the social without dealing with the physical as well. And so, of course, we look at physical well-being as being the absence of a disease, but also it deals with our lifestyle behavior. What are we doing? What are the choices that we making? Are the choices that we're making or enhance our health, or is it damaging our health? Does it allow us to live a balanced state of body, mind, and soul? Once again, we're connecting all of it together. And so what we put in our body, what we choose to do, whether we work out or lay and you know, lounge around, all of these things have a significant impact, not only in our physical, but our mental, our social, our psychological, our emotional, and even too, spiritual too. And so there's so many different connections to this. So why is it important? Why is it important for us to maintain our well-being? Why is it important? And so some key things that I want to identify is when we have a positive mental well-being or a positive optimal well-being, it helps us to realize our full potential. We're able to really identify who we are, be comfortable in that, walk in confidence in who we are, and also be able to cope with the different stresses that happen in life. We're able to be more productive and effective in everything that we do. And once again, we're able to make meaningful contribution to society, but also develop meaningful relationships with people around us. It goes beyond the status quo or the surface where it's just acquaintances, but you start developing meaningful relationships that serve you best and you serve others as well. And so that's why it's very important. Some other key things I want to touch base on why it's important to maintain your well-being is that, once again, it plays a factor in everything that we that makes us us. I can't stress it enough that it's so connected. Everything is connected. So when we don't deal with our well-being, our health, it has such a negative impact on how we view ourselves, view others, how we deal with situations, even how we show gratitude. And that's a significant thing too, that you see that people that are struggling with their mental health, emotional health, their well-being, struggle to see the good in situations that happen. And once again, unfortunately, with this pandemic, we see that being, a reality for us. But the good thing is that we have some answers. And the good thing is that we have some resources that we can share and help people identify why it's important and get on that road of improving their well-being and their mental health. So what happens to your body if you don't take care of your well-being? So this is very important and significant to take into consideration as well. As you can see, we can have some serious health complications that may be heart disease, blood pressure, have issues with that. It also weakens our immune system. This is very important because once again, we're dealing with a pandemic. And so that's important to pay attention to, because if we're not optimizing our well-being, our mental, emotional, physical health, that makes us much more susceptible to attracting COVID-19 or any other disease or virus, because our body is not strong enough to fight off certain things. And so it does weaken our immune system. And also too, there's been some connections between, low well-being, low mental health, and as it relates to different other disabilities and medical conditions such as cancer. And so once again, literature shows us that there is a clear connection between taking care of our well-being and how that seriously impacts our health and our well-being, physically and mentally. Some other adverse outcomes we may see is aches and pains in our bodies. We may see a change in our appetite, extremely tired, lightheaded, problems with our sleep patterns, as well as it impacts our blood sugar. I know some months ago I did a segment on social isolation and loneliness and how it relates to people that are diabetic. And it's very true. Once again, that's another serious medical concern that people don't always pay attention to, but it does negatively impact our blood pressure, our blood sugar, and for those that are diabetic, can be very detrimental to them as well. Financial challenges. So we see once again with this pandemic, there has been people that have lost their jobs, that have been struggling, don't have the resources that they did before. And so once again, it brings back all this stress. And what happens with our body? They say stress is a silent killer, which is very true. It creates a lot of additional issues and concerns that pop up that we need to deal with. So we see that financial challenges is another outcome when we're not dealing with our mental or our well-being. Another component of that is that people can become so lax, or I would say lax, I'm not going to use lazy, but lax, or they start using their finances or their money to things that are not going to benefit them. And so, for example, if someone is very sad and they're going through a depressive state, or they're dealing with social isolation, loneliness, they don't have that connection with their family, their friends, they start turning to unhealthy life, patterns and decisions that such as maybe, alcohol, maybe junk food, maybe, engaging into things or spending money that can be used in other ways on things that are not going to benefit them in the long run. So once again, we see those challenges in the financial sense. Of course, severe mental illnesses, that's another one that pops up. And so we look at people developing prolonged depression, anxiety, and also another connection in the literature is increase in substance abuse disorders. So that's significant too. You see people, especially with this pandemic, spending more time, money into drugs, alcohol, prescriptions, and really abusing those things to help cope with what's going on in the world today. Decreasing their mental and emotional well-being. And so once again, we see people being unhappy in their life, lack of enjoyment, those types of things, unable to maintain a healthy relationship. And so what happens with this? It creates excessive worry and anxiety that leads to social isolation and loneliness. And that's why we're here today, right? We're here to talk about how all these things contribute to social isolation, loneliness, and what we can do to make sure that we put our best foot forward. Like this quote says, it's never too early or never too late to work towards being the healthiest you. And that's very important. So understanding social isolation and chronic loneliness. So once again, we want to understand what it is. And so we understand that social isolation involves a lack of social connections or social contact, which is a direct result of physical distancing and sheltering in place. Once again, with this pandemic, it has caused us to have to shelter in place, caused us to have the 6 feet rule. And so what we normally would do with hugs, simple hug, conversation, meeting, going out to dinner, whatever those things may be, we don't have that anymore. And so it causes a lot of anxiety and stress and a negative impact on a lot of people's mental health. We also see that COVID-19, this pandemic, has contributed to a lot of negative impact. And we're seeing that. We are identifying that. Many of you work in the healthcare field, and you see that with your residents. You see that where, you know, their excitement, their joy is dwindled significantly because they don't have that connection. We also see that loneliness, distress, and increase of symptoms of anxiety and depression. And it also contributes to a lack of alone time. And so once again, there is a such thing as not having that healthy alone time, right? To be able to gather your thoughts and being able to feel comfortable. And so once again, people are having such a negative this experience with just being alone. And the fear of that is that a lot of times that can lead to suicide. And so, you know, people get comfortable, they start rehearsing in their mind that nobody cares, they don't want to be here. All these things start popping up, and unfortunately, we see some connections with suicide as well. So if we're not careful in examining what these warning signs are or what we need to do, address it in a healthy way, what happens is that these feelings of sadness, anxiety, and depression can become more chronic, which leads to severe negative and adverse outcomes. And are deeply rooted to feelings of inadequacy, poor self-esteem, and self-loathing. So once again, we have those key things that we see popping up that we really need to pay attention to. All right, so going on to the next slide, understanding the warning signs. So there are some key things that I want us to pay attention to as it relates to social isolation and loneliness. So social isolation, some of the key warning signs is deep boredom. And so for these people, they don't have no interest, that general interest into certain things that they would like, whether it be, you know, reading, whether it be watching their favorite TV shows, whether it be eating their favorite foods. You see such a significant change in that. They don't want to do it. They don't have no desire to do it. They're withdrawn for those things. So that's a warning sign we need to pay attention to. Not taking care of themselves. People that are typically really key on making sure they look good, their hair is fine. My cousin told me a story because she works in a nursing home too, where one of the ladies wanted her hair combed one particular way all the time. And so she noticed when this young older lady no longer had an interest of making sure her physical appearance was kept up, that was a sign that something was going on. Same thing with poor eating and nutrition. That's a significant factor as well. And if it's not taken care of, it can also lead to eating disorders, significant disrepair. And so once again, people become just lazy in taking care of even their surroundings, making sure things are cleaned and organized, poor quality of sleep, and as well dealing with the cognitive, which we've seen there's been a decline in that as well. So dealing with individuals that suffer from dementia, Alzheimer's, there's a connection with that as it relates to social isolation. So dealing with loneliness, the inability to connect with others once again. And so some key things that people don't always pay attention to, unfortunately, is that these people don't have close relationships. It's more acquaintances, people that they, hey, how you doing? All right, bye. But they really struggle with connecting with other people, building a deep connection. And we all need that, right? I don't know about everybody on here, but for me, I need, I don't have to have 4, 5, 6, but 1 or 2 strong, close, deep relationships that I can talk with them and confide in them and vice versa and open up. But the people that deal with loneliness, and it's a prolonged situation, is that they really struggle with building those connections. Often feel overwhelmed in isolation. And also too, they're not comfortable being around other people. So they develop a social anxiety type of disorder, which is another severe, serious disorder as well. And they have negative feelings of self. So once again, this plays into how people view themselves, how they look at themselves, and that further discourages them from connecting to people. And so once again, they have to get out that negative self-talk and deal with, what they're going through is not a reflection of self. It's just a reflection of what's going on in the world around us, and it's okay. It's possible to deal with it and to heal from it. And then also to exhaustion and burnout can be related to loneliness. So once again, it drains their energy. They become very fatigued. And then these type of people as well, they just become exhausted. No motivation, just tired. They're sleeping, but they're not getting quality sleep because their mind is racing. Their heart is heavy. And so once again, we see some very significant things popping up as it relates to these warning signs. So what are some negative health outcomes that we need to pay attention to? I'm going to touch base on just a couple of them. Some of these negative health outcomes are depression, sleep disorder. We talked about diabetes, high blood pressure, substance abuse. 2 things I really want to zone in on, because literature really emphasizes on these things, is shortened lifespan. And it also deals with increasing suicidal thoughts, especially once again with the elderly population. And later I'm going to talk about one of the key things that you all can do is making sure your staff is well trained, possibly in mental health first aid, because they're aware to identify what those warning signs are, because a lot of times we don't always pay attention to those things. And unfortunately, it leads to suicidal thoughts, and some people may carry it out. But that was interesting for me to know and to learn, is that the literature research shows that there's such a significant connection between the shortening of a lifespan, suicidal thoughts, especially as it relates to the elderly population with social isolation and loneliness. And so there's such a clear connection. And to be truthfully honest, this is something that has been, going on prior to this pandemic, but since the pandemic, it has shed a light even more on these concerns, that they're very prevalent. They're here. And so we want to make sure that people get the knowledge, get the education, and being able to apply these things. Also, too, some of the key things that we want to look at is health risks associated with isolation and loneliness. So once again, premature death of all causes. And so you see that shortening of lifespan playing into that. Increase in dementia. So people are developing dementia, poor social relationships, other health concerns. Loneliness is also associated with suicide, anxiety, and also a significant factor or significant fact is heart failure. Loneliness among heart failure patients have shown to be very higher rates associated with nearly 4 times increased risk of death, as well as hospitalizations, emergency department visits as well. And so what does this also tell us that, and also important for you all that's working in nursing homes, is that it has a decrease in physical activity, which leads to an increase in fractures, and people fall. The likelihood of them falling and breaking something and not being able to recover as well. And so that's another significant fact that you all can take and learn from and implement. And if people don't understand how significant social isolation and loneliness and how it relates to the elderly population, these are some real facts that you can share with them and say, hey, this is what's going on in the world around us and how this impacts the population that we care for. So social isolation and loneliness, once again, relating to this pandemic, we see that this pandemic has disrupted a lot of the mental health services that are needed for vulnerable populations, including the elderly population, youth. Even in literature, it talks about women that dealt with postpartum depression as well. And so since this pandemic, the WHO, World Health Organization, did a survey, and what they got was all these different mental health services have been disrupted around the world due to this pandemic. So that is alarming to us. And what does it tell us? That tells us that there's work that needs to be done, right? But also too, we understand how this is such a public health crisis or concern, because if these services that are meant for people that are dealing with various mental health issues are being disrupted because of insurance, being disrupted because of loss of a job, being disrupted because of loss of resources, being disrupted because the support system is no longer there. Whatever the case may be, we see that this is going to increase those negative outcomes that we don't want to see. And so I wanted to give this information out to you just to motivate and encourage you all to pay attention, learn what's going on in your state, in your arena, your county, and figure out how we can get these resources out to those that are in need. How can you get these resources to those that you care for within your facilities? Because as you can see, this is a public health crisis that needs the more attention to. Also too, we see that there's been some disruptions within the school and workplace. Of course, those that have children can attest to that, or even on your own, you know, moving from being in the office 5 days to now being in the office 3 days or 2 days, or remotely working from home. And so you're working, having kids in the background. And so all these different things have contributed to, you know, social isolation, loneliness, as well as other mental health, emotional concerns that have popped up. And once again, if there's a direct disruption in the services needed to help people with these concerns, that it shows us that more work needs to be done, not only around the world, but even in our backyard. So what are some helpful tools and strategies that you all can use? And so one thing I've learned, and also ties back to the literature, is practice acts of kindness and self-compassion. This is so important. In this pandemic, I believe that one of the biggest lessons for myself and people I've come across is valuing life, valuing the importance of what it means to just be grateful, grateful every day to live, grateful to have resources. I'm grateful to wake up, make it through each month with your family members still here. And so it helps to practice acts of kindness. It doesn't not only helps people that you display these acts of kindness to, like your residents or your staff, but it also helps to improve your mental, emotional, psychological, and physical well-being as well. Positive thinking. So we talked about that before, where how positive thinking positively impacts how we look at the world around us. If we're not careful, we can sink into negative self-talk, which tells us that things are not going to work, it's not going to happen, whatever, but that gives the negative impact that we don't want. So we have to change the way we think. And there's helpful tools out there on the web that you can use, your resident can use, your staff can use to help people start thinking positive. Instead of looking at, oh my goodness, what we lost in this pandemic, say, hey, what have I gained in this pandemic? What have I learned? What opportunities have I had to help someone, to encourage someone, to support someone, to show someone that life is worth living, even though we may be dealing with a pandemic? And so it changed your perspective of how things are. Some other key things is grounding, getting close to nature, which has been very effective. Physical activity, release your endorphins. Music, especially with your residents. I cannot stress this enough. It's so important. Make it a habit to put on some music they may identify with, or, you know, stuff that, you know, ask them if there's certain songs or certain artists or something like that. That cause them to go to that happy place in their mind. That can be very beneficial. Prayer and meditation can be very beneficial as well. Those that are more spiritual. And so definitely you want to tie into those things. Know your residents, know what matters to them. For those that are spiritual or religious and value prayer and meditation, incorporate that. That will help them increase in their overall well-being. Mindfulness, very effective. Very, very, very effective. Learning a new habit or new skill, utilizing technology. I tell my family all the time, we live in an era where technology is at the tip of our fingers. So utilize it. I've heard nursing homes where they purchase iPads or tablets and they have assigned times or they're able to video call with their family, even if their family cannot come and visit them. I'll show you a video soon, shortly, where this nursing home and health department in Colorado created a hug tunnel, because the residents at their facilities cannot go out or vice versa. And so they made it safe for all, but it was very connecting. Even was 15 minutes, 20 minutes, but people were actually there hugging their loved ones they haven't seen since 9 months, since this pandemic, or 11 months, or however long. And it was very sentimental and connecting. And like I said before, be creative. If you think of something like the hug tunnel, I don't know who else is doing that, but I have the tools that if you want to implement that at your facilities, but be creative. It doesn't hurt to be creative. And so with that being said, I want to show this quick video. Once again, this is a video of a health facility and health department back in Colorado that took the opportunity to help their residents connect with their loved ones. And so they built a hug tunnel, and they did this for Valentine's Day. But since Valentine's Day is almost near, you can incorporate this any time of the year. And not only that, be more creative and make it your own. And so I want to take this opportunity. And Steve, are you going to post it in the chat?
Yeah, I'm going to put the, just in case the sound doesn't work. It's only 2 minutes, but if, in case the sound doesn't work on on anyone's computer, I put the link in chat.
All right, perfect, perfect. So let's start the video.
Finally tonight, something we haven't seen during this pandemic. Loved ones separated by COVID, able to hug one another. Until now. It's the moment 97-year-old Vince Schrack and his daughter Carol Braun have been waiting for 8 months. Vince, a World War II veteran, is a father, grandfather, and great-grandfather. And since the pandemic began, he has not been able to hug his family.
Last time I hugged him was probably before COVID in February.
But that's about to change. Outside the Catherine and Charles Hover greenhouses, a senior living facility in Longmont, Colorado, they've set up a tent with 4mm plastic and armholes so families can hug.
Just been looking forward to that hug.
Dad and daughter together again. You can see the joy even through the masks. They did not let go for 5 minutes.
I got to just hold my dad and give him a hug, and it just felt really good.
I couldn't hold her hard enough. She's so sweet, you know, it's just wonderful.
Amanda Meyer came up with the idea and built it with the help of volunteers.
The thought of my residents being alone is very heartbreaking to me.
More than a dozen families got to come together. Each visit allowed only for a few minutes. The tent sterilized with CDC-approved cleaner between visits. Tonight, both dad and daughter telling us they're thankful.
We had a good hug through this chaos.
Being able to give him that 5-minute hug after 8 long months was such a gift.
These hugs are happening around the world. At this nursing home in Italy, they're setting up tents for families as well. Matteo hasn't had contact with his grandmother Santa since March.
She's very, very happy, and also for me it's a great emotion.
Back in Colorado, Carol is already looking forward to that next moment with her dad.
Our time with our loved ones is precious right now, and such an important moment to be able to be face to face, and rubbing his back just meant the world to me.
Such a great idea. We thank all those families for sharing, and we thank you for watching. I'm Tom Yamas in New York. David Mears back here on Monday. From all of us here, stay safe. Good night. Finally.
So as you can see, and I don't know if everyone is crying, but that story it's so significant and so important. But it also gives ideas of what you all can do. And it also shares how important it is to stay connected. Be creative, being able to identify, ways you can connect people with their families during this pandemic. And as you can see in the video, touching stories of people that haven't seen their father, their parents, and loved ones for months because of this pandemic. And as you can see, the elderly population, how this thing is impacting them negatively. Hopefully this video gave some ideas for you all to be able to implement, be creative, try some new things of what you can do. I also wanted to post here, and when we have the question, feel free to share your thoughts of what you thought about the video, how you felt. Did did it bring up some creative juices for you? But also want to share this resource with you all as well. And this gives you the guide of how you can create the hug tunnel. And so once again, if you've never thought about it, you want to, by all means, utilize it, enjoy it, and let's make a difference for those that we care for. And so next I want to talk about getting help, because I know this can be difficult a lot of times, having this conversation with people that you care for, whether it be for yourself, whether it be for your loved ones, whether it be for your residents, for your staff. But I always tell people it's okay to get help. It's so okay to seek out that additional help and support. What we don't want to do, especially dealing with social isolation, loneliness, is make people feel or have people feel as if they cannot open up and share, I'm struggling with this, or I need help with this. And so you may want to, or this will encourage you all to take a little bit more of that accountability and responsibility and just checking in with people. Hey, I just want to check in, see if you're okay. Do you need anything? Have an honest conversation. Even being transparent helps too. So let them know, hey, I understand where you're coming from. It's been hard not being able to connect with my loved ones, not being able to have those conversations, and tell them this is what I've been doing, or what you think can be beneficial. Have your residents respond and not, get their input, get their thoughts. We don't want to get in a habit of implementing things without seeking advice from those that we're trying to help or support in that. So let them know they're not alone. Let them know that, once again, being transparent is proven to be effective as well. Talking to them about the options. And so if you don't know, get the resources, get the things. I'm going to share some things with you in a later slide. Or if not, connect with someone that you know. Hey, can you come and do, talk to my residents, talk to my staff, wherever case may be. Let them know what the resources are and how they can get connected to these things. Share with trusted families and friends. And so this is for you all, as well as those that you support. Being able to share this information and let them know, hey, I know that so-and-so is not dealing with this well. Do you have any ideas? Is there certain things that she likes, she doesn't like? Is there something going on that we can do? Give you an example, my grandma just turned 80 last month. And so we did a virtual birthday party for her. And so that's another perfect example to do. I did the PowerPoint, I did the slideshow, pictures of all her grands and great grands and children. But for her to be turning 80 this year, with everything going on, having COVID twice, we wanted to celebrate her. So once again, these are some ideas that you all can implement and use. And educate yourself on the option. So once again, educate yourself, and not only educate yourself, educate your staff, educate your residents, educate your coworkers, educate people you come across in the community, because you never know who may need this information. Okay, so we also want to talk about treatment. Types of treatment, because there's a lot of different treatment options out there, and I want you all to be educated on what those treatment options are. All right, so looking at treatment options, we see that there's a lot of professional care that can be provided to people that are dealing with just needing to talk to someone. And so for people that may develop more severe mental illnesses or other additional negative impacts based on what they're going through, of course, they can seek out counseling. Medication, depending on the situation, may be beneficial. So for those that are dealing with depression, bipolar, antidepressants are more effective. There's anti-anxiety medication for those that are dealing with anxiety. There's also what we call complementary alternative medication or medicine. And so those fall into aromatherapy. Yes, smell is so important, so that can help. I know for me, when I had a stressed out day and I want to relax, sometimes what I do is I light some candles. I have certain candles, and it helps to relax me. Herbs, herbal, certain things, herbs can be very beneficial, can also help to regulate blood pressure, blood sugar, those types of things. Herbal tea can be relaxing, diet therapy, massage therapy, and spiritual healing. This one too, I want to add in music. We talked about that earlier, but music I believe in is one of the more holistic approaches is a significant piece of how you can help deal with some of these things is music. Music uplifts you. Psychotherapy. So once again, for people that are having a hard time, you know, using those techniques we talked about may not be as beneficial for them. They need more of that one-on-one care, checking in. What has been proven to be effective in the literature is pairing medicine with different types of psychotherapy. And so that's been very effective. And so for that, it may be cognitive behavior therapy. And so that can be very beneficial as well. Where example of that may be talk therapy, which helps short-term treatment. People are able to identify the causes of why they're feeling the way they're feeling, identify the source, and learn helpful strategies and techniques of how to cope with that thing or to address that thing. One thing people learn in CBT and DBT is identifying your triggers. And so that's important, especially as we're dealing with this pandemic. There may be some certain things, as you know, unfortunately, we do have people that pass, but learning to identify some triggers and learning how to cope with these things can be very beneficial for people that are dealing with isolation and loneliness. And lastly, telehealth and telemedicine is very effective. Once again, I hear people say, well, I don't have transportation, how am I gonna get to the doctor? There's a way, there is a way. So I'm excited and happy that we have those services to provide to people because it makes it comfortable. They don't have to leave their home to get the support that they need. So once again, share this with your residents, your coworkers, your staff, and let them know you are supported. There's resources out there that are beneficial. And lastly, there's a lot of resources around the world. I would encourage you to look at the World Health Organization that deals with more global public health crises, but they have a lot of resources on their website as it relates to social isolation and loneliness. There's one particular document that they have that is entitled Mental Health and Psychosocial Considerations during the COVID-19 outbreak. And so they have some clear messages for all populations, for managers and administrators in healthcare facilities, to people that are dealing with isolation, to the general public, to the elderly population. And so there's some good information that they are gathering throughout the year of this pandemic and saying, hey, this is what we noticed, this is what you need to be aware of, how can you best support? And so definitely look at the World Health Organization. They have some very important tools that you all can use. Mental Health America is another one. And so this is important. They have a wealth of information. On this actual website for Mental Health America, they actually have worksheets and things that you can use. So for your residents, if you know coping is something that you want to work on, or certain things that you want to work on, they have worksheets on their website that you can download free and utilize those things. You know, assign one of the staff to come and say, hey, for 15 minutes, 20 minutes, we're going to work on, you know, increasing your positive thinking, or talking to you about why it's important, you know, to talk about certain issues and how we can do that. And also provide some additional resources if you struggle with having those conversations. I had a conversation with a church where I was doing some mental health teaching with them. And a lot of times it's not easy, especially in the church room, to have that conversation about mental health, emotional health, dealing with disorders. And so they also provide some resources to get the conversation going as well. Of course, suicide prevention hotline. And so if you know someone that's struggling, definitely post it, share it with them. And then Daily Strength is another one. They connect people with common issues for mutual support. So that's more like a support group. So that's important too, because once again, you learn a lot from people that have gone through what you're going through. So being transparent, being honest with self and others can be very beneficial. And of course, unfortunately, with this pandemic, we see there are some clear connections with substance abuse as it relates to loneliness and social isolation. And so making sure we're educated of how we deal with substance abuse because it is still prevalent. And lastly, these are my resources. And Stephen, I am ready for questions if you want to go on.
Great. Yeah, boy, this was really great. Let's see. Betty asks, please elaborate on mindfulness.
Okay, so mindfulness, that is a good question. And so mindfulness is a technique. It's a holistic technique. And what mindfulness helps you do is become centered. Okay. So I'll give you an example. The issue a lot of times we have is that we work, but we fail to pay attention to our body and what's going on with us. And so with mindfulness, it can be through meditation. It can be through just quieting your thoughts, being able to center yourself, being able to be in the present. But it also helps you to identify things that you would never really pay attention to if you don't quiet yourself. And so on YouTube, they have a lot of, mindfulness videos. It's from 2 minutes to 5 minutes to 10 minutes, and it's very effective. And what you do is similar to what you would do in, how can I put it? I would say yoga, because yoga, you move around in different positions, but you can lay down, you can sit up, you close your eyes, and it just allows you to pay attention to what's going on. The reason why it's so effective is, and this is something I've learned too, when you're moving around too much, working and not paying attention to your body, a lot of times I hear people say, I have so much pain in my back or in my shoulders. And the issue is that we carry a lot of stress in our back and in our shoulders, right? But you never really understand it until you take that moment, quiet yourself, quiet your thoughts, and pay attention to what's going on in your body. And mindfulness helps you to do that. When you're quiet, you're centered, now you can pay attention to, okay, this pain here or this pain here. Why is this pain here? What is going on? And you start to think, ponder what's going on, and it gives you a greater sense of awareness and relevant awareness and reflection and revelation as well.
Great. And let's see, Kathy Bryan says, have you seen changes in public policy that support these efforts?
Have I seen changes in public policy that supports the efforts of what?
I guess, anything that sort of helps minimize isolation and what have you.
So what they're doing globally, and also I need to read a little more what they're doing in terms of the United States, but there has been such a significant push for getting more resources out to the mental health community, because they see, based on the WHO, as well as research that is being done here in the United States, that social isolation and loneliness has been increased. It was present prior to this pandemic, but since this pandemic, especially with the elderly population, we see such a significant increase in loneliness and isolation. And so they're wanting to get more financial resources out to be able to provide more of that telehealth, telemedication, and as well for mental health organizations and facilities to have those resources to implement more strategies of how they can deal with these factors, social isolation and loneliness. What I can also do, Steve, is okay with you, is that I can share some additional resources that deals with what is exactly going on with the policy. That way you can stay on top of things. I know through my job, I'm connected to what they call Project ECHO, which is a United States or how is it, national program where they educate people on what's going on with this pandemic, with nursing homes particularly, that we deal with them, but we also provide some of them up-to-date, resources of what's going on. And so whatever resources I can get from there, I will definitely share with you all as well. Great question.
Great, and that's a good reminder that the CarePatrol team is going to send out a recording. We've got the PowerPoints that we can share, contact information for Morgan Bird. Mary asks, what do you think about video visits during this COVID distancing?
Very important, very effective. So I would definitely say if you have not started, definitely implement it. I've heard stories where people do, a schedule, and so the residents can go and they can write, on this time to this time, this is my time slot. But definitely, if you have not, it can be very effective. Because even with my family, we started implementing that every week, and it has developed a closeness, people that we normally don't talk to or we didn't get a chance to see. And so it does really positively impact the mental health and emotional health of yourself and your residents as well. So yes, very effective.
Great. All right. Wow. Can't believe we've been over an hour here. So we're definitely going to share Morgan's contact info so that you can reach out to her. Let me bring on the CarePatrol team again, and if any of the CarePatrol team can just do your own video. Again, this is always a challenging thing for me, but there we go. And it looks like we got a few. Okay. And then I also want to bring on Enrique. There. Okay, got Enrique. That's excellent. Well, so on behalf of everybody from the CarePatrol team, I want to thank you, Morgan, for a great presentation.
Very well done.
Thank you. Thank you.
Yeah. And then we want to recognize the sponsor of today's event, which is Access and Oak Manor Healthcare Center. And Enrique, I think you're on there. Can you tell us a little bit about Oak Manor Healthcare Center?
Absolutely. Again, thank you everyone for letting us be part of this exciting initiative by CarePatrol. Oak Manor is part of the Access Healthcare Group since November 2019, when Access had purchased the 7 facilities in Maryland. Access Group has been over 30 years of experience in the industry and leads the healthcare provider in multiple states, such as New York, New Jersey, New Hampshire, North Carolina, Florida, and now the state of Maryland. Since Access Healthcare Group took over Oak Manor, there has been a lot of significant improvements within the facility, such as new leadership, the increased acuity level of care for all the patients that we get from the Baltimore, the Montgomery County regions, and also the prioritizing the quality of care, customer service for our communities. Oak Manor's focus on rehabilitation services and for short-term care patients, such as PT, OT, and speech, as well as tracheostomy, trach services, and in-house dialysis for long-term care and short-term care patients. We also are a Kaiser Core facility, which Kaiser has their own staff, such as nursing and also a physician group. Our goal is always to deliver remarkable care and patients to the community, and we're here to facilitate, the transition from a hospital setting to a subacute, and going back to the community, such as what CarePatrol does with senior health and assisted living.
Great. Wow. Well, thanks again for your support. And then I'm gonna transition to what we always love to finish these discussions off with, is spinning the wheel of names for a door prize. And I tell you, we had a ton of people sign up for this event today. So Enrique, would you like to do the honors and just raise your hand and spin the wheel? All right, let's see who's the winner. All right, it's Barbara Szyminski. And so let me cut and paste that so that we make sure that we get Barbara's gift off. And with that, I will turn things back to the CarePatrol team if there's any final housekeeping items that you would like to share.
Well, I'd just like to, this is Rhonda, CarePatrol, Montgomery, Howard, and servicing the DC area. I would like to thank Morgan. She has been at this for some time, you know, and I really, really appreciate the resources and all the information that she was able to share with us. So again, thank you so much. We truly appreciate you.
Absolutely.
Thank you.
Yes, the video was amazing.
Yes.
It did bring tears to my eyes. So what a great idea.
Yes.
Well, I also like the care pods or the hug tunnels, but also just noting, you know, that was a greenhouse nursing home, and it would be wonderful if we could get a greenhouse in the Mid-Atlantic region, because they really have a great approach to care. So
Yeah.
That'd be great. Yes.
anyways, all right. Well, thanks so much. And we will see everybody next month, and we'll make sure everybody gets the recording.
Thank you, Steve.
Thank you so
Thanks.
much, Steve.
Thank you.
Bye. Thank you.